Now, what I'm going to present is a response to a correspondence that one Marconi published in the Lancet. This is a big medical journal in the UK. Now, in his correspondence, the title was Tanzania Refuses COVID-19 Vaccines. The Lancet, volume 397, published in February this year. As a country, we had to respond. Now, in our response, we narrated very briefly, I'm going to make this presentation, we narrated what we did as a response to the pandemic since March 16th last year, when the first case was reported in Arusha. What we said was, whoever is subscribing to what Marconi said, we are saying they missed the local context, or rather the local context was not sufficiently considered to understand fully the country's position on the COVID-19 pandemic and its use of COVID-19 vaccines. Now, we maintain that the administration understood the severity of the COVID-19 pandemic, which merits joint and coordinated global efforts, as articulated by the WHO representative. Now, in the early months of the pandemic, between February and April 2020, last year, the Tanzanian government quickly implemented various WHO recommended measures. And as of February 27th this year, 2021, the Ministry of Health has issued 15 guidelines on COVID-19 protection. The government decided not to implement a lockdown, as we all know, because that would have restricted public access to health services, especially for patients with chronic conditions like tuberculosis, HIV infection, which in settings like Tanzania, with large burdens of infectious and non-infectious disease, would have had severe effects. Lockdown might have prevented citizens from working, affecting households' ability to afford food or health care, pushing more people into poverty. In February this year, the government reissued guidelines insisting on WHO recommended measures and built local capacity to produce personal protective equipment. For example, Muhimbili, I'm sure my colleague there will allude to that, they now produce face masks. MSD produce face masks. And other local entrepreneurs are doing the same. That's just one such measure that the government took. Now, the government has also adopted complementary traditional remedies that are thought to boost immunity. Tanzania harbors a rich diversity of valuable medicinal plants and has plans to build capacity to intensify research on alternative remedies against COVID-19, and NIMRI, my institution, is very active at that front. Now, such efforts are also supported by WHO, and indeed WHO published an article which reads, WHO supports scientifically proven traditional medicine, that was published in May last year. However, such efforts have been misinterpreted as undermining control measures against COVID-19. For example, issues like the early this year, we are aware of countries that suspended use of Oxford AstraZeneca, but also in South Africa, they did the same. And as the virus started mutating, producing variants that were escaping the vaccine. So such concerns were also raised here in Tanzania. The administration urged the ministry, by the administration here I'm referring to the executive, The executive urged the Ministry of Health to conduct a robust evaluation of all vaccines before accepting their use in the country. Now, what I can say here is Tanzania embraces vaccination programs and consistently shows, and the country, and this is in general, not just COVID vaccines, this is in general, and consistently we have shown high immunization coverage for infants under 5 or the below 5. Over 95% of our below 5 are vaccinated. We uphold the spirit of working collaboratively with local and international agencies in the fight against the COVID-19 pandemic. So Tanzania is not going it alone. We are working collaboratively with the rest of the world in fighting against the COVID-19 pandemic.